I'm going to talk about firefighters' chemical exposure and heat stress in wildland firefighting. And I'm represent the Emergency Services Academy Finland, and I'm working there as a senior research scientist. I'm going to introduce to you our project, which goal was to find best firefighting tools and personal protective equipment for wildland firefighting. We did this project cooperation with the Finnish Institute of Occupational Health and also with the Helsinki Sport Medical Center. This project was funded by the Parliament of Finland and Finnish Fire Protection Fund. Here is the outline of my presentation. I start from the research settings, telling that what we have done and how we have done. Then I also say a few words about methodology, how we measured firefighters' heat stress and also chemical exposure. Then I tell about the results, what we have got so far. And finally, I will conclude the lessons, what we have learned in this project. I start from the research settings, what we did in the first work package of the study. We were very interested in how different firefighting garments affect on firefighters' heat stress. And that's why 4 firefighters tested 4 different garments in 4 one-hour wildland fire simulations in our laboratory conditions. And these tested garments were garments designed for the structural fires and 3 different garments which were designed for the wildland firefighting. In addition, these garments, firefighters used long-sleeved and legged technical underwears, light helmets, gloves, and combat boots. In the second work package, we were interested in firefighters' inhalation exposure to chemical agents. And we did this simulation in forestry management burnings. And there we also simulated different work tasks from the wildland fires. And these tests took about 4 to 5 hours, and we had similar firefighting gears as what we had in laboratory tests, but there was a few exceptions. These firefighters used fan-assisted respirators, and which were equipped with the combination filters. Also, they used carbon monoxide detectors to be able to avoid too high carbon monoxide concentrations. And those firefighters in our test who used a garment designed for the structural fires, they had only shorts and t-shirts as underwear, and they worked without jacket. In fact, this way of protect themselves is very common in Finnish wildland firefighting. In the third work package, we wanted to test our developed improved protection settings compared to our traditional way to do firefighting in wildland fires in Finland. And in this work package, we had 8 firefighters who worked in pairs, and they tested both protection settings. And these tests took about 2 hours, and they were carried out in our wildland fire training track, which one we built to our training ground. And there we simulated different kind of firefighting tasks what we have in wildland firefighting. This improved protection comprised garment designed for the forest fires, long-sleeved and legged technical underwears, and respirators. And this traditional protection comprised garment designed for the structural fires, and firefighters used shorts and t-shirts as underwear, and they worked without respirator. Then to the methods, what we used to measure firefighters' heat stress. We measured firefighters' skin temperature from the different part of the body. Also, relative humidity was measured under the firefighting garments from the surface of the shirt. Firefighters' core temperature were followed with the swallowable temperature capsules, and also firefighters' sweating were recorded by weighing firefighters and also their clothing before and after tests. And also firefighters' heart rate was recorded. We also measured firefighters' chemical exposure, and the inhalation exposure was followed with the active and passive samplers and direct reading instruments. And these samples were taken outside the breathing zone, outside the fan-assisted respirator. So we can call this measurement potential inhalation exposure measurement. Also, we measured firefighters' actual thermal exposure. We took samples from the different part of the body under the firefighting garments. Firefighters' total exposure was followed from the urine, blood, and exhaled air. And then to the results. What we learn about laboratory tests. On the left, you see the average temperatures on the skin when firefighters tested those garments in laboratory conditions. And as you can see, the blue line separates from the other lines, and these values were obtained from the firefighters who used garment designed for the structural fires. And these other ones shows the values measured from the firefighters who used garment designed for the wildfires. And as you can see, there is a clear difference. And this means, of course, that those who used garment designed for the structural fires has a higher heat stress, but also this means that when your skin temperature is higher, then also the chemical absorbs more easily through the skin. On the left in the upper picture, you see the core temperature of the firefighters, and you can see that after 40 minutes test start, the blue line separates from the other, showing again higher heat stress. On the right, you see the firefighters' weight loss during the tests. And when they used garment designed for the structural fires, their weight loss was almost 30% higher. Also, sweating absorbed into the clothing was 60% higher. So it's very valuable to know that what kind of garment you used in wildfire. Okay, little problem with the change of the slides. Okay, there is coming. Okay, then we also followed firefighters' heart rates during the 1 hour tests, and this color code is very similar as in previous figure or graphs. And again, you see that blue lines are up on the graph, showing highest physical stress of the work. This is also indicates that when you have a higher physical stress in your work, then you definitely breathing more, and when you're breathing more, you exposed more. And here are the results from the work package 3, where we tested traditional way to protect and improved way to protect in our training ground. And these results are very similar as we saw in the laboratory test. Traditional way to protect caused higher skin temperatures, higher heart rates, higher relative humidity under the garment, and also the weight loss and sweating was higher. And then to the chemical exposure part of the results. And on the left, you see the results of the aldehydes. Aldehyde are the chemicals which are responsible of those irritative effects of the smoke. And we did the characterization of different kind of aldehydes, and we noticed that most important aldehydes in wild and firefighting are acrolein, which is probably carcinogenic agent, and formaldehyde, which is a carcinogenic agent. The average values were very close to the occupational exposure limit values, showing significant exposure to these aldehydes. This underlines that we have to have respirators in wild and firefighting, which also removes these vaporous chemical agents from the inhaled air. Also, we found benzene and benzoapyrene from firefighters' breathing area. These both chemicals are highly carcinogenic. Then we also looked at chemical agents which exist in particular phase. And as we all know, at the fire site exist lots of smoke which contain very, very fine particles. And we also wanted to test that how much wild and firefighters, how much they exposed to this inhalable dust. And the average value of all our tests was over the occupational exposure limit value, showing significant exposure to particles. Also, we looked what kind of elements we have in this inhalable dust. And we analyzed 36 different elements from the dust. And the most important, at least in Finnish forest fires, was manganese concentrations. Manganese is neurotoxic compound. Also, we were interested in, can forest fires elevate radioactivity in certain areas? And we knew beforehand that especially Pieksämäki region was got the highest fallout of cesium-137 from nuclear power plant from Chernobyl 1989. And our results verified that, and we able to find the highest radioactivity level from firefighters' inhalable dust samples from the Pieksämäki region. Luckily, these values were still far away from the action limit values what we have for this radioactivity. So these didn't cause any health impact to the firefighters, but we can say that that at a certain area, wildland fires might elevate radioactivity concentrations. Then a few words about carbon monoxide exposure. In the upper picture on the left, you see the variation of the carbon monoxide concentrations in test persons' breathing area. And when we looked the average values of all tests, we saw that it was about 80% of occupational exposure limit value for carbon monoxide, showing already significant exposure. But then we looked also the short-term exposures, these peaks, what we recorded. And in Finland, we have 75 ppm occupational exposure limit value for these short-term exposures. And this value is allowed to exceed only once in hour. And as you can see, there is much more those exceedances than once, showing significant exposure. Also, we were interested in, can we measure firefighters' carbon monoxide exposure from the exhaled air? And that's why we compared inhaled air measurements to the measurements from the exhaled air immediately after exposure. And as you can see, there was a pretty good correlation between those values, showing that we can use exhaled air monitoring at the fireside. Also, we compared inhalation exposure to the measurements from the blood, and that correlated also very well. What we learn about dermal exposure. When we did this comparison between the traditional way to protect and improved way to protect, we noticed that in the lower body, thermal exposure was 90% lower when they used this improved protection, which comprised long-sleeved and legged underwears. In the upper body, the reduction was 70%. What else we found? We measured firefighters' total exposure. Again, when they used improved protection and traditional protection. And we took samples from the urine before exposure to see, do they have any background concentrations? And then we took samples immediately after exposure and 6 hours after end of the exposure. And as you can see, when they used improved protection, there was a slight increase their urinary excretion of 2-naphthol, which indicate exposure to naphthalene, the simplest polycyclic aromatic hydrocarbon. But when they used traditional protection, there was a much higher excretion. So it's valuable to use fan-assisted respirators with the combination filters. And let me end to the conclusions. And I have put some lines under the preparedness topic. And what is the most effective way to reduce firefighters' exposure? It is definitely to prevent wildfires. And that's why we're thinking that it's very important that fire brigades enhance public awareness of fire risks during the forest fire season. When the fire is ignited, we have to improve fire detection capabilities to be able to keep those fires as small as possible. Also, we learned that those things what we have trained, be able to do the best way. That's why it's very valuable to strengthen firefighters' preparedness. And we have also proposed that fire brigades develop comprehensive forest fire protection plans for their own area. to enhance their readiness for wildfire firefighting. Also, we have updated targeted protection plans for the most sensitive areas, such as nature parks, feed production areas, forestry management areas, and shooting range, and so on. Also, we have tested fire sensitivity maps, which indicate vegetation and ground fire sensitivity, to be able to prioritize the most sensitive area for ignition. And when we have this information, we can engage landowners in fire prevention discussions that can be change, for example, vegetation in certain area. Can we establish fire protection lines in urban planning? And probably we can do some prescribed burns in such certain area to reduce forest fire risks. Very important word is situational awareness, and it's very important that we have a real-time situational picture. For example, weather data, ground profiles, vegetation information, and probably we have fire and contaminant spread modelings too available, that we able to select the best distinguished tactics and techniques for the each cases. Also, this improve our ability to estimate resource needs, assistance, and also evacuation plans. And the point is that we are able to reduce unnecessary workload, unnecessary exposure, and we can enhance occupational safety for all personnel. What else we can do? We can reduce firefighters' workload. We can use ATVs to assist it in hose laying. Also, we can use lighter hoses. We have also tested some chemical fire retardant agents, which one we can establish restriction lines. Also, we have proposed and recommended to use excavators and forestry machinery when we have to remove topsoils and create necessary openings into the forest during the forest fire. And in some cases, we can use, of course, aerial support. We can use this kind of modified forest harvesters and probably some fire extinguishing trailers. What we learn about personal protective equipment. We noticed that garment designed for the violent fires, they can reduce firefighters' physical stress. And when they have these long sleeve and leg technical underwears, we can reduce also the thermal exposure. Fan-assisted respirators are necessary to reduce inhalation exposure, and same time they protect your eyes. And but unfortunately, these filters, what we have in these respirators, they're not able to remove carbon monoxide from the inhaled air. And that's why it's valuable to use this kind of a carbon monoxide indicator, that they're able to avoid too high concentrations. In the cut of the tip of the fire, under the wing, there is very demanding conditions from exposure point of view. And that's why firefighters must use pressurized breathing apparatus in those areas. Also, we have reminded that cabins of heavier machinery should be equipped with fresh air filters or compressed air breathing apparatus for the driver's safety. Also, we noticed that combat boots, what is here, provide better ankle support in different terrains than regular fire boots. And protective helmet must meet at least the requirements of industrial helmet standard. And if we want to reduce hand exposure, heat-resistant protective gloves with the cuffs are needed. And maybe in future we have this kind of smart PPEs which provide us firefighters tracking location, exposure situation, and how well they performing to ensure their safety and health in real time. Then we also recommend that we have had good organization which take care of the maintenance and decontamination of the firefighters and their equipment. Water and food supply is very essential. Also, firefighters have to wash themselves immediately after end of the exposure to cut their thermal exposure. And also we need clean personal protective equipment. We can also use exhaled air monitoring to check how much firefighters are really exposed in their firefighting. And is it safe to continue working? And last but not least, we have to take care that work shift does not go too long and that we have enough resources for this firefighting scheme situation. Thank you for your attention.